Hi, I'm Dr. HQ from HQ Dontics Miami, and today we're going to talk about a procedure that a lot of patients ask about, and it's called All on X. I'm going to tell you about why you need it or why somebody would need it, how is it done, and what does it take to get there. Okay, let's start. So the All on X dental procedure is basically a procedure that we do on patients that are going to have all their teeth extracted for whatever reason. If it's negligent dentition, I mean, they have a lot of problems and they're not going to be able to keep all their teeth. And so we do this procedure where we place 6 implants at least, and we call it All on X because it's all the teeth over an X amount of implants. So we're going to use implants placed strategically in their available bone, and then we're going to set new teeth over those implants. So the new teeth are going to be retained immediately over those implants that we're going to place. So All on X procedure is a very innovative kind of procedure, and the main difference is that usually we needed to wait a certain amount of time for the tissue and the bone to heal against the implants, and so that would take months sometimes. For the All on X procedure, we are placing at least 6 implants in a particular jaw, either the upper or the lower jaw, and by placing 6 implants we can stabilize both sides of a whole arch, and so we can immediately use those implants. So the patient basically enters the room without the implants or with their teeth. We're going to extract their teeth, place the implants in those strategic positions. As you see here in the screen, we are placing 6 implants, and then after that we are going to actually attach the new prosthesis over these 6 implants immediately. So the patients are going to enter with their teeth and they're going to leave with a new set of fixed teeth over the 6 implants or more that we have placed. So most patients are going to be good candidates. Of course, people are going to go through the problem of getting their teeth extracted if that's what they need, because we cannot save them for whatever reason, like I said before. But any patient that is in good health condition, regardless of the age, as long as they are controlled diabetics, if they are, the patients that have uncontrolled diabetes or are smokers are usually the only patients that are going to be contraindicated for All on X type of procedures. Most patients are indicated for them. Considering that we have a 3-dimensional scan of their jaw and we can see the volume and the height and all the available bone for that particular patient, we can always strategically place implants in a way that we can use them for this type of procedures. In a very few amount of patients, we would have to go through additional procedures that can involve bone grafting and additional waiting time for those implants to be placed. So the process for a patient that wants to undergo this type of procedure is quite simple in terms of the amount of time or chair time that the patient is going to go through. The planning behind the scenes is very delicate and very involved, and basically starts with us taking an impression of the existing condition of that patient, or it can be a 3-dimensional impression or a physical impression. We need a CT scan, which is a 3-dimensional image of the bone and the jaw of the patient, so we can see what the available bone is. And after that, we're going to start designing the prosthesis. The design of the prosthesis is very important because based on that, we're going to create the provisionals that are going to then be delivered over the patient's implants after the surgery or the day after the surgery. So basically, the patient will come in for the first visit, we'll take the exams, 3-dimensional scans, 3-dimensional x-rays. It will take some time for us to be able to determine that this is a good candidate for the procedure. We'll plan the procedure. We'll create the surgical templates. The surgical guides are going to allow us to put the implants exactly where we need them. And then we're going to put the provisionals over those implants at the surgery or at the day after the surgery. So for the patient, it's basically maybe 1 to 3 visits until they can get their new teeth. So when you replace dentition, or when you are fixing diseased dentition, you want to think about the longevity. You want to think about how long do those teeth are going to last. Are they going to last a long time? Are they going to last 10 years, 2 years, 5 years? So you want to know how long they're going to last. So sometimes patients are exposed to periodontal disease and things like that can diminish the lifetime of existing teeth. So in those cases, we think about implants. Implants, they cannot be decayed. they can only suffer from bone loss. So, it reduces the chances for failure when you have multiple implants and you can restore them at the same time. On the screen, we have right now a case of a before and after of a temporary over implants. In this particular case, on the right side of the screen, you see how the patient arrived at the surgery room, and then this is how she left. So you can see that the difference is maybe not substantial from what you see there, but she has all her set of teeth that have been designed previously to her appointment. So the before and after is great when you see failing dentition and then you have something solid that you can use and you can chew on in just a few months. Because you're removing defective or failing dentition, diseased teeth, you're removing also bacteria from your mouth. So by doing this, you are actually having a healthier condition where you are going to diminish the chances for heart disease, for example, for diabetes and for Alzheimer's and so many other diseases that are now linked to your oral health. So by having a healthy mouth and removing teeth that are diseased, you are creating great conditions to have a longer life and healthier life. Every procedure has certain amount of complications that can happen. So implants, they also have certain amount of complications. Mostly are going to be related to bacteria, infections, and rejection from the host or the patient. So whenever we place an implant, there is always a very small chance that the implant will not integrate on the bone and it will have to be removed. In most of those cases, the implants can be easily replaced and we would need to extend the waiting period, but it can be solved. The cost for this type of procedures can vary greatly depending on the amount of implants that we use, the complexity of the case, the type of materials that are used, and of course the type of patient and the length of the treatment. Most of the times we tell patients that this type of treatment can cost a medium-sized car. It sounds very expensive, but it is a life-changing type of procedure that is going to reduce and eliminate mostly all your problems that you have, at least dentally. So the recovery process, it's very fast. Patients usually start feeling better at the second or third day after the procedure. The diet that they need to have for those initial month or 2 months is a soft diet. That is probably one of the challenges. But in terms of recovery, like in any surgery, there is certain amount of discomfort that can be felt, but it's something very tolerable under like pain management. A dental procedure like All-on-X should last for a long time, especially if you take care of it and you do your regular checkups and you allow us to make sure that everything is fine. Your bite will change in time, so you need to allow us to be able to fix that in order to have an equilibrated bite, so you are not going to put excess of forces into your implants. We can say that a procedure like this can last sometimes a lifetime. Most of the times if something happens to the suprastructure, that is basically the teeth that are fixed over the implants, and that can be easily fixed or replaced. The type of care that All-on-X requires is basically what you're doing right now at home. Basic brushing, flossing, and making sure that there are no food traps, and keeping your oral hygiene at home, of course, and then doing your regular checkups at the dentist. So the care that the All-on-X implant requires is basically once a year. Sometimes we need to remove the prosthesis, make it clean, and then we can replace the screws and put it back. The implants are gonna stay there as the foundation, but we can make sure that there is nothing underneath the prosthesis that is not well and properly kept. So we can take that time to clean the prosthesis, polish everything, and put it back. Once we do that, you're gonna be like right on your way.